You know, in the presidential race, all the attention is on South Carolina and the Republicans. Last week, I looked at Mitt Romney's handling of health care as Massachusetts governor. Well, today, two of his rivals. Newt Gingrich has been blasting so-called Romney care. He calls it big government, high-cost, bureaucratic. But he hasn't always felt that way. In fact, back in 2006, Gingrich called it exciting and said, quote, "The health bill that Governor Romney signed into law this month has tremendous potential to affect major change in the American health system." On the controversial question, should everyone be required to have insurance, Gingrich says he's changed his mind. In fact, listen to what Gingrich had to say about mandates specifically on NBC's Meet the Press.
I've said consistently, we ought to have some requirement. You either have health insurance or you post a bond, or in some way you indicate you're going to be held accountable.
But that is the individual mandate, is it not?
It's a variation on it.
Now, one thing Gingrich and Romney have in common is that they both want to repeal Obamacare and start over. This week, Gingrich posted details of his plan on his website. Some highlights of it: more high-risk pools to cover people who are too sick to find insurance. Also, change Medicaid into a grant program, mostly run by states, and give Americans generous tax credits to purchase their own health coverage. Now on to Congressman Ron Paul of Texas. As you may know, he's actually a physician. He practices an OB-GYN. He says the government should stay out of the healthcare business really altogether. He says Medicare and Medicaid are, quote, unconstitutional. And that led to a controversial moment at a CNN debate where Paul was asked a hypothetical question. What if you have a 30-year-old man who doesn't buy insurance and then gets into a terrible accident? Who should pay the hospital bill? Paul says the 30-year-old should assume responsibility. Take a listen.
That's what freedom is all about, taking your own risk. This whole idea that you have to prepare and take care of everybody.
But, Congressman, are you saying the society should just let him die?
No. I practiced medicine before we had Medicaid in the early 1960s when I got out of medical school. I practiced at Santa Rosa Hospital in San Antonio, and the churches took care of him. We never turned anybody away from the hospital.
Under Paul's plan, a person could buy insurance or choose to pay their doctors cash, but in both cases, they'd get 100% tax credit for every dollar spent on health care. Like the other Republican candidates, Paul says we can make health insurance more affordable by letting people shop across state lines, forcing companies to lower prices to become more competitive. Now, in other news this week, Paula Deen announced she has diabetes. That's right, Paula Deen.